What is a stroke? 5 warning signs and prevention tips for seniors. Are you worried about stroke risks or unsure how to spot the warning signs? Great news! With simple knowledge and habits, you can protect yourself and your loved ones. Welcome to Health at Any Age, your trusted channel for senior wellness. Today, we're diving into what a stroke is, the 5 critical warning signs, and practical prevention tips for those over 50. Stick with us, these life-saving insights could make all the difference. Before we start, I'd love to hear where you're joining us from. Drop your city in the comments, share any questions, and hit that subscribe button with notifications on so you never miss a tip from Health at Any Age. First, let's talk about what a stroke is and why seniors need to understand it. Part 1. What is a stroke and why should seniors care? A stroke happens when blood flow to the brain is blocked, often by a clot, or a blood vessel bursts, causing brain cells to die from lack of oxygen. There are 2 main types: ischemic strokes, which make up 87% of cases and occur when a clot blocks a vessel, and hemorrhagic strokes, caused by bleeding in the brain. Strokes are the 5th leading cause of death in the U.S., and the CDC says 1 in 4 adults over 50 is at risk, with the risk doubling after 65. Every year, about 800,000 Americans have a stroke, and 140,000 die. But here's the good news: up to 80% of strokes are preventable, per the American Stroke Association. Learning about strokes today helps you stay healthy and independent. Now, let's explore why seniors are more prone to strokes. Part 2. Why are seniors more prone to strokes? As we age, blood vessels narrow, and plaque from fat and cholesterol can block blood flow. Conditions like high blood pressure, affecting 70% of seniors, increase stroke risk 4 times if untreated, per the American Heart Association. Diabetes, common in 1 in 4 seniors, damages vessels, while atrial fibrillation, an irregular heartbeat, raises risk 5 times. Smoking, inactivity, and high-sodium diets worsen the odds. Women over 50 face higher risks post-menopause due to hormonal changes, with a 2020 study showing a 10% increased risk compared to men. Family history also matters. If a parent had a stroke, your risk may be higher. But small changes can lower these risks significantly. For example, John, a 62-year-old, survived a minor stroke and now walks daily to stay healthy. Next, let's dive into the 5 warning signs using the FAST method. Part 3. The 5 warning signs of a stroke, FAST. When a stroke strikes, time is critical. Brain cells can die within minutes without oxygen, so recognizing the signs and acting fast can save a life. The FAST acronym is a simple, memorable tool to help you spot a stroke and get help immediately. Let's break it down step by step, with examples to make it crystal clear for you. F. Face drooping. One side of the face may droop or feel numb, like it's not responding. Ask the person to smile. If one side of their face sags, stays flat, or only half their mouth lifts, it's a major warning sign. For instance, imagine you're having coffee with a friend, and when they try to smile, the left side of their face doesn't move at all. That's a red flag you can't ignore. A. Arm weakness. Ask them to raise both arms to shoulder height and hold them there. If one arm drifts downward, feels weak, or they can't lift it at all, it's a sign of a stroke. Picture yourself at a family gathering, and your spouse tries to raise their arms but one arm falls limply or feels heavy, like they're holding a weight they can't manage. That's a clear warning. S. Speech difficulty. Their speech may be slurred, garbled, or they may struggle to find words or speak at all. Ask them to repeat a simple phrase, like, "The sky is blue." If the words come out jumbled, like, "thicky blue," or they can't form the sentence, it's urgent. For example, if your partner tries to answer a question but their words sound like a mumble or they pause in confusion, take action. Time to call 911. If you notice any of these signs, face drooping, arm weakness, or speech difficulty, call 911 immediately. Don't wait to see if symptoms improve, and don't drive to the hospital yourself. Paramedics can start treatment on the way. The American Stroke Association emphasizes that getting to a hospital within 3 hours can make the difference between recovery and permanent disability. Every minute of delay means 1.9 million brain cells lost, which can affect memory, movement, or speech. Other signs to watch for: beyond fast, be alert for sudden confusion, like forgetting where they are or what they're doing mid-sentence. Vision problems, such as blurriness or double vision in one or both eyes, can occur. Dizziness or trouble walking, like stumbling or losing balance unexpectedly, is another sign. A severe headache, often described as the worst headache ever, with no clear cause, may indicate a hemorrhagic stroke. To bring this to life, let's share a story about Mary, a 67-year-old grandmother. One evening, she was chatting with her husband at dinner when she noticed his face drooping on one side. She remembered the fast method, asked him to raise his arms, one wouldn't move, and then tested his speech, which was slurred. She called 911 immediately. Because she acted fast, her husband received a clot-busting drug within an hour at the hospital and fully recovered. Knowing fast saved his life, and it can save yours too. Let's answer a common question: what if the symptoms go away quickly? These could be a transient ischemic attack, TIA, or mini-stroke, which lasts a few minutes but is a warning sign for a major stroke. Even if symptoms disappear, call your doctor right away. Next, let's move on to 5 practical prevention tips tailored for seniors to keep strokes at bay. Part 4, Prevention Tip 1, Eat a heart-healthy diet. Your diet directly impacts heart and brain health, reducing stroke risk. Focus on foods rich in antioxidants, fiber, and healthy fats. Fatty fish, salmon or mackerel, eaten twice weekly, 3 to 4 ounces per serving, lowers stroke risk by 6%, per the American Heart Association, thanks to omega-3s that reduce inflammation. Berries, blueberries or strawberries, 1 cup daily, cut stroke risk by 10% with antioxidants, per a 2019 study. Add to yogurt or smoothies. Leafy greens, spinach or kale, high in potassium, 800 mg per cup of cooked spinach, regulates blood pressure. Whole grains, oats or quinoa stabilize blood sugar and cholesterol. Try this salmon spinach salad: mix 4 ounces grilled salmon, 2 cups spinach, half an avocado, and lemon olive oil dressing. It takes 10 minutes. Avoid high-sodium foods like canned soups, 800 mg sodium per serving, stick to 1,500 mg daily. Dark chocolate, 1 ounce, 70% cocoa, is a heart-healthy treat in moderation. Next, let's talk about exercise for stroke prevention. Part 5, Prevention Tip 2, Stay active with gentle exercise. Regular physical activity is one of the best ways to strengthen your heart, improve blood flow, and lower blood pressure, all of which reduce your stroke risk. Seniors don't need to hit the gym or run marathons. Low-impact exercises are safe, effective, and easy to fit into daily life. A 2019 study published in Stroke found that just 30 minutes of moderate exercise 5 days a week can cut stroke risk by up to 20%. For seniors, moderate means you can talk but not sing while moving. Let's explore some options tailored for those over 50, including those with mobility challenges or chronic conditions. Walking is a fantastic starting point. A 10-minute walk around your neighborhood or local park burns 50 to 70 calories, boosts circulation, and reduces stress. Aim for 30 minutes daily, which you can split into two 15-minute walks if that's easier. For example, walk to your mailbox and back, or stroll with a friend to make it social. If you're new to exercise, start with 5 minutes and add 1 to 2 minutes each week. Chair yoga is perfect for seniors with arthritis, joint pain, or limited mobility. It improves flexibility, strengthens muscles, and reduces stress, all of which support heart health. Try simple poses like seated arm raises, leg lifts, or gentle twists for 10 to 15 minutes daily. For instance, while sitting, extend your arms overhead, hold for 5 seconds, and lower them. Repeat 10 times to improve shoulder mobility and blood flow. Swimming or water aerobics is another great option, especially for those with joint issues. Water supports your body, reducing strain while working your heart and muscles. A 30-minute session twice a week can improve endurance and lower blood pressure. If you don't have access to a pool, try chair-based water bottle exercises. Lift small bottles like weights for arm strength. Here's a quick exercise to try right now: seated arm circles. Sit upright in a chair, extend your arms out to the sides, and make small circles forward for 1 minute, then reverse for another minute. This boosts circulation and loosens your shoulders. Do this twice daily to feel the benefits. If you have conditions like arthritis or a heart issue, check with your doctor before starting any new exercise. For example, Susan, a 70-year-old viewer of our channel, started walking 15 minutes daily after years of being sedentary. Within a month, her blood pressure dropped, and she felt more energized. You can achieve similar results. Let's answer a question: what if I can't exercise much? Even light activity, like stretching or gardening, helps. The key is to move regularly, even if it's just 5 minutes at a time. Next, let's discuss why managing blood pressure is critical for stroke prevention. Part 6, Prevention Tip 3, Manage Blood Pressure. High blood pressure, or hypertension, is the single biggest cause of strokes, damaging blood vessels over time and making clots or bleeding more likely. The CDC reports that 70% of seniors have hypertension, but only about half keep it under control. Uncontrolled high blood pressure can increase stroke risk by 4 times, so managing it is essential. Your goal is a blood pressure reading below 120/80 mmHg, where the top number, systolic, measures pressure when your heart beats, and the bottom number, diastolic, measures pressure when it rests. Let's break down how to manage it effectively as a senior. First, check your blood pressure regularly. Home blood pressure monitors, available for $20 to $50 at pharmacies or online, are easy to use. Take your reading in the morning before coffee or activity, sitting with your feet flat and arm at heart level. Check weekly and record your numbers in a notebook or app. For example, a reading of 140/90 mmHg is too high. Talk to your doctor if this persists. Normal fluctuations are okay, but consistent high readings need attention. Second, eat potassium-rich foods to balance sodium and lower blood pressure naturally. Bananas provide 400 milligrams of potassium per medium fruit, about 10% of your daily needs. Sweet potatoes, avocados, and spinach are also excellent sources. A 2021 study in hypertension found that eating 1 banana daily can reduce blood pressure by 10% in some seniors. Try slicing a banana over oatmeal or blending it into a smoothie with spinach and berries. Third, Cut sodium intake to no more than 1,500 mg daily, as recommended for seniors. High-sodium foods, like chips, 200 mg per ounce, processed meats, 600 mg per hot dog, or canned soups, 800 mg per serving, can spike blood pressure quickly. Check food labels for low-sodium options, and cook with herbs like rosemary or garlic instead of salt. For example, make a homemade vegetable soup with fresh carrots, celery, and no salt-added broth to keep sodium low. If you're on blood pressure medication, take it exactly as prescribed and discuss any side effects, like dizziness, with your doctor. Some seniors skip doses, thinking they feel fine, but this can be dangerous. Regular monitoring saved Bob, a 65-year-old retiree, whose high readings led to early treatment, preventing a stroke. Let's answer a question: how do I know if my blood pressure is too high? Symptoms are rare, so checking regularly is the only way to catch it. If you feel headaches, dizziness, or shortness of breath, see a doctor immediately. Next, let's explore how quality sleep can lower your stroke risk. Part 7, Prevention Tip 4, Get Quality Sleep. Poor sleep raises blood pressure and stroke risk. A 2020 neurology study linked less than 6 hours of sleep to a 15% higher risk. Aim for 7 to 8 hours with these tips. Bedtime routine: avoid screens 1 hour before bed, sip chamomile tea. Bedroom setup: keep it dark, quiet, and cool, 65 to 68 degrees Fahrenheit. Relaxation: try 4-7-8 breathing, inhale 4 seconds, hold 7, exhale 8, for 2 minutes. Sleep apnea, affecting 20% of seniors, doubles risk. If you snore or feel tired, ask for a sleep study. Linda, a 68-year-old, used a CPAP device and improved her health. Next, let's cover smoking and alcohol. Part 8, Prevention Tip 5, Quit smoking and limit alcohol. Smoking doubles stroke risk by damaging vessels. Quitting cuts risk in half in 1 year, per the CDC. Try small steps: cut 1 cigarette daily, use gum or walks to cope. Support: call 1-800-QUITNOW or ask about nicotine patches. Tom, a 60-year-old, quit in 3 months, boosting his health. Limit alcohol to 1 drink daily for women, 2 for men. Heavy drinking raises risk by 45%, per a 2018 study. Swap cocktails for sparkling water with lemon. Next, let's plan how to start today. Part 9, How to start protecting yourself today. Start small: eat a banana, walk 10 minutes, check blood pressure, practice 4-7-8 breathing, or cut 1 cigarette. Visit your doctor to monitor diabetes or cholesterol. Set a goal, like eat salmon twice this week, and track it. Sarah, a 72-year-old, improved her health with greens and walks in 6 weeks. Next, let's summarize. Part 10, Final Thoughts. You can lower your stroke risk. No fast, face drooping, arm weakness, speech difficulty, time to call 911, and use our 5 tips: eat healthy, exercise, manage blood pressure, sleep well, quit smoking. Which tip will you try? Comment below with your plan or story. We love hearing from Health at Any Age viewers. If this video helped you understand strokes and how to prevent them, please hit the like button. It helps us reach more seniors with life-saving tips. Don't forget to subscribe to Health at Any Age and turn on notifications to catch our weekly health insights. Next week, we'll share a heart-healthy meal plan to prevent stroke, complete with easy, budget-friendly recipes tailored for seniors. Stay tuned. Stay informed, stay healthy, and we'll see you in the next video.